Okay. Hi, my name is Sam. I'm going to be your nurse today.
Hello.
Okay. So, first, can I ask your name?
James Robert Brady II.
Okay. How old are you, James?
I am 22.
Okay. I see that you are a white male.
Mm-hmm.
Okay. What do you do for a living?
I'm a truck driver.
Okay. What does that job entail?
A lot of sitting for long periods of time, a lot of driving, not very much physical use of limbs or anything like that, just hand-eye coordination.
Okay. What is your marital status?
I am engaged.
Okay. So what brought you in today?
Just regular checkup, and I've been having some muscle pain in my legs and my back.
Okay, well, we're going to take a look at that, okay?
Okay.
Okay. Do you have any past medical history that it would involve something like this?
As far as I know, no. I mean, I've slipped and fallen on sidewalks and stuff, but it's never had any type of long-term injury deal.
Okay.
Anything like that.
So when did this pain start?
It's probably been, I'd say, about 3 weeks.
Okay.
Or so.
Where exactly is this pain?
The majority is in my groin muscle, and I have some in my lower back.
Okay. How long would you say this pain usually lasts?
Oh, pretty much the duration that I'm at work, which can be anywhere from 12 to 14 hours, and I can even continue when I'm home. So.
Okay. What does this pain feel like? Does it feel sharp, dull? Does it feel like somebody's pulling on you? Can you describe it for me in your own words?
It's a very sharp, almost muscle tearing kind of feeling.
Okay. And then what makes this worse?
The sitting for long periods of time, that makes it worse. Whenever I sit for a long time, get out of the truck and walk, it gets worse. If I walk or stand for extended periods of time, it can make it worse.
So what makes it better?
Laying down, relaxing, that kind of thing, as long as I'm not overusing it, I guess you could say.
Okay, and you said that for the duration of most of this, it can pretty much happen for the entire time that you're working.
Mm-hmm.
Okay. And then, are you experiencing this pain right now while you're laying here?
Not terribly.
Okay. On a scale like 1 to 10, 10 being the worst pain you've ever felt.
I'd say it's maybe like a 1.5, 2.
Right now?
Yep.
Okay, so something of it's a nuisance, but not the worst thing you've ever felt.
Right.
Okay, whenever you're sitting in the truck, what would you say it is on the scale 1 to 10?
It gets up to about a 5, 6.
Okay. So I'm going to ask you a little bit about your past history, and then we're going to go ahead and get into the exam. Okay? So, past medical history. Have you had any past medical problems? Do you know any of their significant dates?
When I was a kid, the only thing I can think of is I had H1N1.
Mm-hmm.
I had asthma as a kid. I'm trying to think. I don't think I had anything other than that was significant.
Okay. And whenever you say you were a kid, what age, do you know a year?
I'd say it was around 08 or 09. I would have been in the 3rd grade.
Okay. Do you have any past surgical history?
No.
Okay. Have you ever been in a hospital for an extended period of time?
No.
Okay. What are you on any medications?
Protonics.
Okay. Can you tell me the dosage of that?
40 milligram.
Okay. And how often do you take that a day?
1 pill once a day.
Okay. Do you know what you're taking that medication for?
My heartburn and acid reflux.
Okay. And you were diagnosed with this when?
That would have been a year ago.
Okay. Okay. And you said you take it as a pill?
Yes.
Okay. Do you have any allergies that you know of?
Just seasonal, and I have seafood allergy.
You do have a seafood allergy. Okay. Do you have any communicable diseases? Anything that you can spread to somebody else that would include AIDS, HIV, TB, smallpox, anything like that?
No.
Okay. Have you had any traumatic injuries or accidents?
The only thing, can't even probably count as traumatic, is a broken wrist.
Okay. Do you have any disabilities or handicaps?
No.
Okay. Do you have any childhood illnesses other than the H1N1?
And the asthma. The asthma's the only other thing I had as a child other than
Okay, you've had asthma as a child?
Yes.
Has that since been resolved? Like, are you managing it well now?
Yes.
Okay. Do you have any rescue inhalers that go with that?
No.
Okay. Have you ever had a blood transfusion?
No.
Okay. When was your last immunization other than your childhood requirements?
Probably I had My last tetanus shot, I was in early high school, so I would have been probably 16 or 17.
Okay. Have you ever had the influenza vaccine since then?
Not sure. I believe I have, though.
Okay. Have you had a hepatitis vaccine at all?
I believe yes.
Okay. Do you know about when you've had those?
I think I got them in a row right around early high school, somewhere in there.
Okay.
I think I went for a good strain.
Okay, so next I'm going to go into your family history. Do you know how old your parents are?
My dad is 42 and my mother is 40.
Okay, and they're both alive?
Yes.
Okay, do either of them have any sort of significant health issues?
Both of them have high blood pressure.
Okay.
My dad, he had gallbladder issues when he was younger. Trying to think as far as that goes, I think it's just the high blood pressure for both of them that's a significant issue.
Okay, and then your grandparents, let's say your maternal side, so your mother's parents, how old are they roughly?
The 67 and gonna be 68.
Okay, are they both alive now?
Yes.
Okay, do they have any significant health issues?
Same thing, high blood pressure, high cholesterol. My grandmother has COPD.
Okay.
Aside from that, I think that's all that's going on with them.
Okay, and then your paternal side, that would be your father's parents. Do you know anything of them?
They're estranged. I don't know a thing.
Okay, that's fine. Okay, I'm just going to get into a little bit about your health maintenance, like what you do. What is your sleep schedule like?
I usually get about 4 to 6 hours a night. I get up very, very, very early morning, go to work.
Okay. What's very early for you?
Anywhere between 11 p.m. and 3 a.m.
Okay. What is your diet?
It's not the best.
Okay, can you describe that a little bit?
Very low on vegetables and fruits and high protein meats. Being a truck driver, you stop at the truck stops, eat what they have. It's not, it's definitely not the healthiest diet.
Okay. Do you get any exercise outside of the truck? I know you said you work long hours.
Very little, but what I can get, I get.
Okay. What do you like to do for exercise?
I like to wash my truck, which it is very physically exerting. I like to go for walks. Just kind of do things around the house, mow the lawn, do things like that to get me moving.
Okay. Do you use any safety devices while you're at work? Helmets, seat belts, gloves, anything like that?
Yeah, we have to have our seatbelts on. We have to have our hard hats on when we're outside the truck. We have to have goggles on. We have to wear gloves. Have to have steel-toed boots, long pants, long sleeve shirts, things like that.
Okay, and then do you go for regular healthcare checkups?
Yes, I do once a year.
Okay. Do you go to a dentist?
Yes.
Do you go to an eye doctor?
Yes.
Okay. Do you go to any other specialist at all?
No.
Okay. Now I'm going to ask you a couple other questions about your personal life. Do you drink alcohol?
Yes.
Okay. How much would you say?
Not very much. If it's a 6-pack every 2 or 3 months, I'm lucky.
Okay. Do you ever drink hard liquor?
Every so often.
Okay. Do you use tobacco?
Every so often. I have the occasional cigar.
Okay. How often is this occasional cigar? Once a month, maybe?
I can go months.
Okay.
Without.
Are you exposed to secondhand smoke at all?
Yes.
Okay. By who?
My mother and my grandparents.
Okay. How much would you say they smoke a day?
Quite a bit. I'd say my mom's at least a pack a day. Same with my grandparents.
Okay. Have you ever tried to quit, or have they ever tried to quit? And have you failed or been successful in these?
They have tried to quit, haven't had luck. I've never had myself in a position where I felt I needed to quit.
Okay.
Per se.
Okay. So have you ever used any illicit drugs?
No.
What are your sexual practices?
I am active.
Okay.
Same partner though.
Okay. And have you both been tested?
Yes.
Okay. What is your travel history? Like, have you been out of state?
I just came back from Maryland.
Okay.
From a weekend trip this week.
Okay. Were you exposed to anything out in the elements? Were you exposed to any large groups of people?
Just the guys in my family.
Okay. What is your work environment like?
It's very dusty, dirty, grimy. I'm around diesel fuel, oil, coal dirt, lime dust, just things of that nature.
Okay. Anything else about work?
Not that I can think of. No.
Okay. Your home environment, what's that like?
It's very, very clean. The house is very clean. Even though my mother smokes, she keeps it very clean. Keeps it in one place in the house or outside, not exposed to any bad chemicals or anything of that nature. It's very good.
Okay. Do you have any other hobbies or leisure activities that you like to do outside of work?
Oh, I'd like to work on my pickup truck. I like to keep up with my work truck, keep it clean and whatnot. Go out with friends, I just like to relax, like I said, go for walks, things like that.
Okay. Um, do you have any major stressors in your life?
Um, I mean, my job's stressful to begin with. Being a truck driver is a very stressful job. But aside from that, I mean, it's just your everyday, just keeping up with bills and everything like that.
Okay. Do you have what is your education?
Highest education I have is an adult trade degree.
Okay. High school, did you get a GED or a diploma?
I got a high school diploma.
Okay. What economic status would you classify yourself as?
Middle, lower.
Okay. Um, do you have any military service?
No.
Okay. Do you have any military service in your family?
Yes.
Okay. Who?
My great grandfather, World War II vet. I had a cousin that was in Iraq.
Okay. What religion would you classify yourself?
Roman Catholic.
Okay. How devoted are you to this religion?
Rather devoted.
Okay. Ethnic background. What do you identify as?
This is a white Caucasian.
Okay. What are your roles and relationships with those around you?
I am a son, grandson, brother, and fiance.
Okay. And then can you just describe like a typical day in your life, just so that I can get some patterns of what your life is normally like?
Yeah, I wake up early morning, go out to my truck, get it ready, go to work, take about an hour nap in the truck, waiting to get loaded. Get loaded, and then it's steady trucking pretty much from anywhere from 3 to 5 a.m. to 1, 3 in the afternoon. I usually stop at least 2 or 3 times a day for restroom breaks throughout the day. Have lunch, a small lunch throughout the day, come home, relax, have dinner, watch a little bit of TV, and then it's pretty much shower, back to bed for work again.
Okay. All right, so now we're getting to the point where I'm going to start doing a full examination of you. Okay? So I'm going to be asking you questions, and I'm going to be doing some assessments along with those questions. And we're basically just going to be working from head to toe, working through each system. Is that okay with you?
That is fine.
Okay. So the first thing I'm going to ask is, have you experienced any fevers, chills, or night sweats recently?
No.
Have you experienced any weakness, fatigue, significant weight loss, or weight gain?
No.
Okay. Again, your age is 22.
Yep.
You are a male.
Yep.
About how much do you weigh?
I'd say about 220.
Okay. And about how high are you?
5'8" to 5'10".
Okay. I noticed that the patient's affect is good, positive. He's appropriately dressed and groomed. I can see that he has good personal hygiene. His facial expression is appropriate to all questions. His manner is very pleasant. He has my full attention, and he is giving me all of his. His speech is clear, and he has a good mental status, as he is awake, alert, oriented to me, his surroundings, and everything else. So the next thing I'm going to do is I'm going to assess your vital signs. Okay, so I'm going to go ahead and start the blood pressure on you. And this is going to get a little tight around your arm, okay? All right, while I do that, I'm going to get your temperature. Your temperature is 98.5. And I have a pulse ox here, so if I could see your other arm and put this on your finger. And this is going to measure the blood oxygen in your system. And then while I do that, I'm just going to take a quick listen to your heart. Okay?
Mm-hmm.
Okay, so your blood pressure is 112/76. That's pretty good. And then your heart rate is 76. And your blood oxygen is 97. So all is within normal range. And good. So next I'm going to ask you some questions about your skin, your hair, and your nails, just your personal opinion of what you've noticed. Have you noticed any abnormal skin color changes on yourself? Any abnormal dryness? Have you noticed any lesions, marks? Have you noticed any abnormal rashes, masses that you can grab a hold of? Any abnormal itching or infections?
No.
Okay. Have you noticed any hair loss, excessive hair gain in any abnormal places? Any strange textures that you've noticed? Anything like that?
Nope.
Okay. Do you use any perms or dyes in your hair?
No.
Okay. How regularly do you maintain with your hair?
I usually go and get it cut, I'd say every 2 or 3 months, and, wash and take care of it every night.
Okay. Have you noticed any sort of changes in your nails? Like, do they look a little different? Are they a weird color? Have they seemed a little bit more brittle than normal? Texture weird?
Nope.
Okay. So let me just take one look at your hand here. So I see that your skin is pink and that your hands are not rough. They're actually pretty smooth, so they're well maintained. I don't see any abnormal lesions. I can see along your face and your legs that you have no abnormal lesions. Your capillary refill was less than 3 seconds, and your nail angle was less than 160 degrees. Next, I'm going to move on to your head and your face and work down through your body. So your head, have you noticed any abnormal headaches, any facial pain, anything like that?
Nope.
Okay. I'm just going to take one look at your head. If you could look up for me, lift up your head. Okay. Your hair has good texture. Your skull is intact. Your scalp is intact. I don't see any abnormal baldness or anything else like that. You have good even hair distribution across your head. I can see that your hair is brown, and so are your eyebrows. I can look at you here, and your trachea is midline, and your carotid is palpable on both sides, and I can feel that nice and strong. It's not weak, it's not too bounding, everything's good. You are not sweating or abnormally shivering, so I notice everything is normal. Next, I'm going to go on to your eyes. What is your current vision? Can you see okay?
Yeah, the only thing is I'm nearsighted.
Okay, so you have your glasses?
Yep.
Do you wear those all the time?
Yes.
Okay. Have you noticed any pain in your eyes?
No.
Any redness, awkward discharge, or excessive tearing, excessive dryness?
Nope.
Okay. Have you noticed any swelling of your eyelids?
No.
And then you said you do use corrective lenses, and you wear those all the time?
Yep.
Okay. So I'm just going to take one look at your eyes. So if you can just take your glasses off for me. Okay, can you close your eyes for me? And then open them. Okay. So your eyelids are not swollen. Your eyes are not hooded or anything else like that. Your lashes are long, full. Your conjunctiva is clear, and there's no drainage or anything like that, no buildup. I see that your eyes are a hazel color, and then I'm just going to use a light real quick. So this is going to test for perla, and this is going to test your extraocular movements after we're done, okay? So if you want to go ahead and take a look at me and look at my nose, okay? There's going to be a bright light. Just keep watching my nose. Okay? Okay. And then I want you to look at the tip of my pen and only follow it with your eyes, okay? Okay. Perla is at 3 millimeters and extraocular movements are intact. Have you noticed any dizziness or anything else like that whenever you're looking around or anything like that?
Nope.
Okay, so he has no signs of vertigo. His retinas are clear, and I see no signs of arteries or veins, so they are intact, and his optic disc is clear. So next we're going to move on to your hearing. Do you have any issues with your hearing?
No.
Okay. Do you wear ear protection at work when you are around loud noises?
Yes.
Okay. Do you have any pain in your ears?
No.
Have you noticed any abnormal discharge?
No.
Okay. And then, do you wear any hearing aids at all?
No.
Okay. What are your care habits of your ears? What do you do?
All I have to do is clear the wax from it every so often. Other than that, we're
Okay.
in good
Do you
shape.
do that yourself, or do you have somebody do it for you?
I have my mom do it.
Okay. What does she usually clear out of there? Is it a discharge, or is it wax? Or
Wax.
Okay. So what I'm going to do is I'm just going to have you look to the one side so I can look into your ear. And what I'm going to do is pull back on the pinna and pull up as I would in an adult. In a child, I would pull and pull down. And then can you look to the other side for me? Okay. So I see that his auricles, his mastoid, and his ear canals are clear and intact, and he has no abnormal drainage. I did note some wax, but the patient said that this is normal. I saw tympanic membranes are not inflamed or swollen. I do not see a need for a Weber test or a Rhines, as it is not applicable that his auditories, there is no abnormalities. So next I'm going to go on to your olfactory. Have you noticed any issues with your smelling? Anything like that? Smelling anything weird, not able to smell things you normally would?
Nope.
Okay. Do you have any pain in your nose, up in your nostrils, throughout your face at all?
No.
It would be like up in your upper cheeks, any pain?
Nope.
Okay. Have you had any awkward discharge, itching, nosebleeds? Do you frequently get infections?
Nope, nothing.
Okay.
Like that.
And then have you had any sneezing fits at all?
No.
Okay. So I'm just going to take one look at your nose. So you can go ahead and put your glasses back on and look up for me. So I'm just going to look into your nose here. And then have you ever had any piercings at all?
No.
So I see that his nares are clear and he has no sign of infection or any current bleeding. His septum is connected, I can see, and it is not inflamed. His mucosa is moist, and there's no swelling of the sinuses that is visible or that he is complaining of. So next I'm moving on to your mouth. Do you have any pain in your lips, mouth, gums, or tongue?
No.
Okay. Anything in your throat? Any irritation?
Nope.
Okay. Have you noticed any lesions or bleeding in your throat, your mouth, your gums?
Nope.
Okay. Have you noticed any tooth pain, any loose teeth, anything like that?
The only thing I have is my wisdom teeth are coming in. That's it.
Okay. And then do you have any dentures? Have you ever had any fillings or anything like that?
No.
Okay. Have you ever had any difficulty chewing because of this?
No.
Okay. Have you ever noticed that your mouth is excessively dry or that you're excessively salivating?
No.
Okay. Have you had any recent changes in taste where you can't taste certain things or things just taste bad to you?
Nope.
Okay. Have you had any hoarseness in your voice or any changes of any sort?
No.
And do you routinely go for dental care?
Yes.
And then do you routinely brush your teeth and floss?
Yes.
Okay. So I'm just going to go ahead and look in your mouth here. Okay. So go ahead and say ah.
Ah.
And then say ah again for me. Okay, and then open up and look up. Okay, and then go ahead and look down. Okay, and then I'm just going to smile for me. And I'm just going to pull down on your lip a little bit so I can see your gums. Okay. So I see that the lips are moist and symmetrical. His tongue is also moist in midline. His sublingual region is moist with no lesions. His mucosa and parotoid glands and his hard and soft palate are moist with no lesions and no redness and no signs of drainage of any sort. His uvula is midline and intact with no inflammation. His tonsils are grade 0 with no inflammation, and they're symmetrical with no redness or any drainage noted. His posterior pharynx is moist with no redness or lesions or swelling, and then his dental care has no caps, and his gingivae are pink with no lesions, and I can see that everything is, he has no buildup or anything else like that. So the next thing I'm going to ask is about your neck and your lymph nodes. Have you noticed any stiffness or pain in your neck? Any abnormal masses or swelling or tenderness?
No.
Okay. So I'm just going to take a quick look at your neck here, and I'm just going to feel all of the glands this hurt at all?
Mm.
No tenderness. Okay, just let me know whenever, if it is. Okay. Can you move your arms a little bit? There you go. Okay. So your pre-auricle and your post-optical, tonsillar, submaxicular, submental, superficial clavicular, posterior clavicular, deep clavicular, supraclavicular, infraclavicular, and epitracheal, axillary, and inguinal have no signs of pain, tenderness, and I do not feel any sort of masses. Okay? Okay, so next I'm going to move on to your chest or your breast. Have you noticed any recent changes in size, appearance, lesions, discoloration, any sort of pain, anything like that?
Nope.
Okay, so I'm just going to ask you to pull up your shirt for me. We will not show the camera. Okay, so I'm just palpating the breasts. Are you feeling any pain at all?
Nope.
Okay. There's no discharge. Nipples are pink with no lesions and no signs of discharge or anything else like that. Okay. And you have no tenderness. Okay. So next we're going to go on to your respiratory system. Have you noticed any recent coughs or sputum production at all?
No.
If you did have sputum, like just because you were coughing randomly, did you have any blood or was it any sort of weird colors?
No.
Okay. Have you been experiencing any wheezing?
No.
Shortness of breath?
No.
Dyspnea on exertion?
No.
So that would be any sort of losing your breath whenever you're running, walking, anything like that?
No.
Okay. Do you have any functional limitations because of your breathing?
No.
Okay. So I'm just going to ask you to take some nice deep breaths for me while I look at you. Okay. And then I'm just going to take a listen to all 4 quadrants of your lungs. So I'm actually going to have you sit up for me, okay?
Okay.
Okay. So I'm going to go underneath of your shirt through the top.
Okay.
And then I'm going to listen to all quadrants, all areas of his lungs. Okay. And then go ahead and take a nice deep breath for me. Okay. Now listen to the bronchial tree. Go ahead. Okay. Go ahead and take another one. Okay. Go down here. Go ahead and take another breath. I'm going to go up through here just so it's a little bit more comfortable on you. Go ahead and take a deep breath. Good. And then take another breath. Okay. And then take one more breath here. Very good. And I'm just going to do the same thing on your back. Okay. We're going to lift up your shirt in the back, okay?
Okay.
All right, I'm going to start over here and just take a nice deep breath for me. Good. Again. Good. Again. Good. And then I'm moving down a little bit. Go ahead again. Moving across and again. And again for me. Good. Down one more time. Go ahead and take a nice deep breath. Very good. Moving across again. And then one more time for me. Very good. Thank you. Okay, so I see that your diaphragm is symmetrical whenever you're breathing. You have a regular rhythm. I've counted your respiration rate of between 16 and 18, which is normal, and you're using very minimal effort, and you're not using any accessory muscles, posterior or anteriorly. Your breath sounds are clear in all areas, and I did not notice any dull percussion. You have no abnormal sounds during agophony, bronchophony, and you do not have any sort of whispers in your lungs, okay? So the next thing is cardiac. Do you experience any chest pain?
No.
Have you noticed any palpitations at all?
No.
So like feeling like your heart's going to beat out of your chest?
Nope.
Okay. Orthopnea, so whenever you're running around, do you feel like your heart's going to explode? Do you have any pain, anything like that?
Nope.
Okay. Do you have any sort of dyspnea related to your heart at all? Okay. Your blood pressure was again 112/76, which was normal. And have you ever had murmurs in the past?
No.
And then has your heart ever limitedly functioned your limitations?
No.
I said that wrong. I'm sorry. Okay, so the first thing I'm going to do is check your carotid. Okay, and I can see that these are both strong and both are non-distended, and he does not have distended jugular veins. So then I'm going to... What am I going to do next? Oh, I'm going to listen to your heart. Sorry. Thought there was something else I had to do. Okay, so I'm going to listen to your aortic, pulmonic, tricuspid, and your mitral. Okay? So I'm going to listen to your heart. Okay? Strong S1 and S2. And I'm going to flip over. And I hear no S3 or S4s. And I'm going to move over. Strong S1 and S2. Negative S3 and S4. Move down. Positive S1, S2, negative S3, S4. And then one more time. Sorry. Okay, positive S1, S2, and no S3 or 4. So everything is clear. I hear no murmurs, and I hear no presence of an S3 or S4 in any of your valves. Okay? So next we're going to move on to your GI tract. Have you noticed any change in your appetite? Any foods that are intolerable to you? Have you noticed any difficulty swallowing?
Nope.
Nausea, vomiting?
No.
Heartburn?
I have heartburn, but that's what I have the protonic.
Okay.
So.
Any sort of pain that's out of the normal for you?
No.
Abnormal swelling, like in your stomach or anything else like that? Anything you've noticed?
Nope.
Okay. Whenever we talk about your bowel movements, what is your frequency with that?
Seems to be normal. Nothing out of the ordinary.
Okay. What is the normal color for you?
Normal, nothing.
Brown. Okay.
Yep, nothing abnormal.
Okay. Consistency. So are they formed? Are they loose? Anything like that?
Yeah, I'd say normal, whatever you would consider normal. Nothing out of the ordinary. Formed,
Okay.
Not, yeah.
Okay. Do you experience any rectal pain whenever you're having a bowel movement?
No.
Okay. Have you noticed any black or bloody stools?
No.
Do you have hemorrhoids or any pain like that?
No.
Have you had any excessive flatulence or anything like that?
No.
Do you use laxatives or any sort of functional aids?
No.
Okay, so you would say that you have no functional limitations when it comes to your GI tract.
Right.
Okay, so I'm just going to have you lay back down again
Okay.
so I can do an abdominal assessment on you. And the first thing I'm going to do is inspect your stomach and just make sure that there's no lesions or abnormal visual things. So I'm going to say that your stomach is flat, intact with no lesions. I see no sort of abnormal masses. So upon inspection, the abdomen is normal. So the next thing I'm going to do is do a light percussion. So this is going to be listening for dullness. I should hear a sort of residency through your abdomen. And then I should have no dull or painful issues whenever I get to your liver or to around your kidneys. Okay? Okay. So I'm just going to go ahead and I'm palpating all 4 quadrants here, and then I'm going to palpate the lobes of the liver. Not palpate, percuss. Okay, and then I'm going to percuss the spleen. Okay, and then we'll do everything with your kidneys whenever we have you sit up again. So the next thing I'm going to do is I'm going to do palpations.
Okay.
So first I'm just going to start in your abdomen and do all 4 quadrants. And then I'm going to do your liver and your spleen, and then I'm going to have you sit up and we're going to percuss and palpate your kidneys. Okay? Alright, so any pain or tenderness?
Nope.
Okay. Alright, so this was my light palpation, and then I'm going to do a deeper palpation. So you should feel no pain, but you might feel some pressure, okay? It might feel ticklish to you. Okay. Any pain? Any sort of pain?
Mm.
Okay. Anything like that?
Mm.
Okay. Alright, so what I'm going to do next is I'm going to go to your liver.
Okay.
So what I'm going to have you do is take a nice deep breath in for me.
Okay.
And then take a nice deep breath out. Okay. And there's no pain or tenderness whenever I do that.
Mm.
Okay. So I'm going to have you do it again real quick. Nice deep breath in. And deep breath out. Okay. And then I'm going to feel for your spleen right here, okay? Nice deep breath in. And a nice deep breath out. And you have no sort of pain or tenderness whenever I'm doing this? Okay, so I see that the liver is non-distended or tender. I see no abnormal masses. I feel no masses. And then I feel no bumps noted on the spleen. Nothing is changing upon inspiration or expiration. And then I'm going to check your kidneys real quick. So if you want to sit up real quick for me. Oh. Or you can stand up if that's actually easier. Good. All right, go ahead and turn around. All right, I'm just going to feel your kidneys here. So go ahead and take a deep breath in. And then go ahead and take a deep breath out. Any sort of pain? Okay. And then again, ready? Take a nice deep breath in. And then take a nice deep breath out. Any sort of pain?
No.
Okay. I'm just going to. No? Okay. And I hear no issues with that either, so you can go ahead and take a seat one more time.
Okay.
So I see no issues with your kidneys. They're non-distended. They don't seem infected or anything else like that where they would be hurting or anything else like that, okay? Okay, so talking about your kidneys, let's move on to your urinary frequency. About how often do you go a day?
I'd say probably 4 to 5 times a day.
Do you go at night at all?
No.
Okay. Do you have any issues whenever you don't go?
No.
Okay. Have you ever noticed any blood in your urine?
No.
Okay. Have you noticed any changes in the force of your stream at all, like while you're going?
No.
Hesitancy, where you feel like you have to go but you're not?
No.
Okay. Have you had any instances of incontinence where you're having an accident?
No.
Okay. And then have you noticed any dribbling or anything else like that, either at the beginning of your stream or at the end of your stream?
No.
Okay. Have you had any history of infections or stones?